Hi, I'm Caroline Harris, and I am an OBGYN. I got interested in medicine at a very young age, about age 7. I started looking into the first pair of glasses and changed my world. And so I decided to be an optometrist, and I did that up until I was a junior in college. And then I decided it just wasn't as much as I thought it was going to be. I shadowed a few times and decided that I needed something more. I had a friend who was going into obstetrics and gynecology for residency, and that sparked the interest there in my junior year of college. And then following that, I went to medical school, got pregnant with my first child, started my own journey into motherhood, and decided this is absolutely what I was meant to do. I think all patients need to know that they have a provider that are going to listen to them, because more than often the problem that the patient is focusing on really affects other parts of their life. And so if I can understand the problem and how it affects their life, I could potentially come to a solution that works best for them. I like to see patients of all ages, and ranging from adolescents to women who are wiser, postmenopausal years. Some of those women haven't seen a provider for 15, 20 years because they've had a hysterectomy or don't have any bleeding or concerns. But I urge patients in that age range to come visit a gynecologist, because there can be other things that we can follow up on, certain things that they have neglected to talk to other providers about, or they don't feel comfortable having a women's exam with their primary care provider. So that's a piece that I like to provide, is taking care of those skin issues and those other postmenopausal concerns that aren't addressed by primary care. I love seeing patients after their first pregnancy test, because it's excitement, it's the hope of what's to come, it's the uncertainty, there's a bunch of anxiety. And if I can, with a little bit of education, provide them what to expect, then that helps reduce anxiety, makes the pregnancy go a little smoother. And that's the most exciting thing for me, is just the moment that the mom becomes a mother. Our practice has a lot of other providers in our office, and we all see patients in a clinic that is one floor away from where we see patients for labor and delivery. So if you come to our office, our providers, even if someone gets called for delivery, we have another one that can step in to see you unless you have the ability to wait, and then we would love to see you after that delivery. Oh, outside the office, I like to exercise, probably spend time with I have 2 sons. They are both interested in different things. I have a son who's interested in basketball and baseball, and so my husband and I are big UK basketball fans, so we watch a lot of NCAA basketball.